Good morning, student. My name is Ms. Manisha Borkar, Department of Fishery Science, NES Science College, Nanded. Now, today we will going to start the B.sc second year, semester 3rd, theory paper 6. The name of paper is Fish Disease Management. Theory paper 6. The name of paper is Fish Disease Management. Now, today's we will going to start the unit number 4, environmental induced diseases of the fish. In previous lecture, we studied the gas bubble disease, oxygen deficiency, then the thermal stress. Today's we will study the stress due to pH variations. Now, firstly, what is meant by the environmental induced disease of a fish? Environmental diseases, the majority of fish health problems are related to environmental stress, such as the effect of handling or a poor water quality. Where an infectious disease is involved, this is the end result of an interaction between the pathogenic organism, a susceptible fish host, and environmental stress. Most prevalent diseases of environmental conditions of fish are environmental hypoxia, gas bubble disease, ammonia poisoning, nitrate poisoning, temperature stress, and stress due to variation in pH values. Now, seen here, stress due to pH variations. Okay, variations means that there is a difference between the pH values. Firstly, the low pH is called as acidic pH. Fish species differ in their optimal pH range. Okay, due to the optimum pH level, fishes can be differ. A pH range of 6.5 to 8.5 is generally recommended for a freshwater fish. A pH of more than 11 or less than 4 is lethal to most fish species. Many freshwater fishes come from poorly buffered waters that are high in organic acids and thus do best in a neutral to slightly acidic conditions, while marine fishes require a stable alkaline pH. pH values do change somewhat during each 24 hours depending upon the temperature, quantity of plants, algae, algae and others, and the size of the pond. So try to take the measurements at about the same time of the day. Fish accumulated to a relative low pH can survive a drop in a pH better than the same species maintained at a higher pH. Fish routinely exposed to wide pH fluctuation are more tolerant to rapid pH change than the fish kept under more stable conditions. Now, rapid changes in a pH can cause extreme stress to the fish, similar to shock in humans. Many toxins are highly affected by pH, especially metals, which become more toxic at a low pH. Aluminium is more soluble and more toxic in acidic pH. Thus, aluminium toxicity can occur and may be the principal cause of the death. Established ponds will normally maintain their equilibrium pH value if decaying organic materials is routinely removed from the pond, mechanical filter and biological converter. Now, the causes of the low pH water. Groundwater well or a spring has dissolved carbonates, carbon dioxide and silicate, so has a low pH. Soil type highly influence pH of the water. Acid sulfate soils may have a pH less than 4 because oxidation of a sulfide to sulfuric acid. Acid rain or water that drains acidic soils have the low pH. Large amount of acids are washed into a stream water supply. In a closed systems, the metabolic activities of fish and other aquatic organisms produce acids that tend to gradually reduce pH if water change not regularly performed or the pH not adjusted. Now the bicarbonate carbonate buffer system is the major moderate of pH in an aquatic system. Alkalinity is the buffering capacity in water and is measured by the amount of bicarbonate then the carbonate present within the water. Water with high alkalinity which resist pH changes from acids produced by the aquatic organisms respiration, that is CO2, and low pH is the most common in a water with low alkalinity, because the lower the alkalinity the less the buffering capacity of the water to neutralize acid production. Pond pH is influenced not only by the amount of bicarbonate which is present but also by the photosynthesis. In that photosynthesis, the plant photosynthesis uses CO2 rising, the pH reaching peak near sunset at a night sensation of the photosynthesis, which results in a net accumulation of a CO2 causing drop in a pH. Now the clinical signs of the low pH, which acute acidosis characterized by tremors and the hyperactivity. Gill tissue is the primary target organ in which low pH stimulates increased mucus production, which interferes with the gas and ion change leading to respiratory and the osmotic stress. Chronic acidosis is associated with poor growth, reproductive failure and the increased accumulation of heavy metals. Now the diagnosis of the acidic pH, which in case history, in acute cases there are acute mortalities with tremors, hyperactivity and dyspnea. In chronic cases there is increased mucus production. In clinical signs, which measurement of the pH of the water by colorimetric test or the pH meter. Now the treatment of pH, acidic pH, frequent change of water which reduce the stocking density, add buffer which raise alkalinity by adding calcium bicarbonate, sodium bicarbonate, concentrate blocks, limestone or the even eggshells to raise the alkalinity by 40 ppm and 1.5 of the calcium carbonate precipitate powder per 100 gallons of the water. A concentrate block or the two submerged in the pond or a filter area may be all that is needed. Be sure to check and treat for any ammonium presence of before attempting to raise the pH through the either chemical or the water changes out, means that the ammonia increases in a toxicity with rising the pH. Then adjust the pH only if ammonia level is safe. In periodic pH measurements are important. Change in a pH from 7 to 6 means 10 times more acidic water. A further drop to a pH of 5 equals 100 times more acidic water, which keep in mind to change pH slowly as it causes a lot of stress to your fish. Now maintaining a stable pH is generally more the way to go. Now the alkaline pH, which is the high pH, we are called as the high pH. To high alkaline pH is much less common than to the low acidic pH, because most closed culture systems which tend to decrease in a pH with the time, and acids are a much more common environmental contaminants than the alkalis. Alkalinity is related to the amount of dissolved calcium, magnesium and other compounds in the water, and as such alkalinity tends to be higher in a harder water. Now the lime leaching out of concentrated ponds is a primary source of the alkalinity, but it is also slowly increased by evaporation which concentrates the source compounds. Alkalinity is naturally decreased over the time through the bacterial action, which produces acidic compounds that combine with and reduce the alkalinity components. Now the causes of the acute high pH: high level of alkalis leaching out of inadequately pure concentrate containers. Now the improper use of slag or the hydrate lime will rapidly rise the pH. Chronic high pH in a ponds is caused by the presence of excessive phytoplanktons and thus excessive photosynthesis, which consume the CO2 during the daytime. In that clinical signs and the problems created in the high pH. In high pH in the ponds, which is dangerous because it increases the amount of toxic unionized ammonia, then corneal damage, long term conditions above the 9.0 can cause kidney damage, hypertrophy of the gill mucus cells and epithelial cells. Then alkaline pH increases the mortality of the incubating eggs. Acid water is somewhat bacteriostatic. Then the diagnosis and the treatment. Case history, which is important: lime treatment of the pond, cloudiness of the skin and the gills. In that clinical signs we mention in that the low pH, measurement of the pH of the water by colorimetric test or the digital electronic pH meter. In the treatment of the high pH, which adding water will dilute the pond water and which reduces the pH. High alkalinity is normally prevented by routine water which change outs, assuming the tap water has a lower alkalinity than the pond water. Adjust the pH by adding buffers, that is phosphate buffer. Calcium and the alum are used successfully in the ponds, which is the precipitation of the calcium carbonate inhibit the rise in a pH. Filtering the water through pit will reduce the pH. Now in the killing some of the plants and algae with an appropriate herbicide, but not usually recommended because of adverse side effects, which are low dissolved oxygen, which is resulting from the decreased photosynthesis, and possible herbicides which toxicity to the fish. They having the high dosage of the herbicides to the phytoplanktons within that the water. Concentrate containers which should be cured with hydrochloric acid and allow to leach out all alkali before using for a fish culture. Now after cure is complete and the pond is ready to be filled for use, now you can put in a few test fish, recheck after each water change out and again in a 24 hours. Do not forget to check the pH of the water being added. It may be part of the problems. At a pH of 9, do daily 10% to the 25% of water change outs. For a pH of 10, which do the 25% to the 50% water change outs. At a pH extremes over 10, which remove any remaining fish only under emergency conditions, which should chemical means be used to the lower the pH in a pond. Any attempt to the lower the pH chemically can be particularly hazardous or the dangerous to the the biologic converter and the fish. As we seen here the pH variations, we will see the low as well as the high pH within the environmental conditions due to the variations which is takes place in within the pH variations with different acidic and the alkaline pH will be takes place due to the high and the low pH. Thank you. शांत राहा.